All right, how do we fight the winter blues, you may ask? Well, here's one remedy. Acupuncture. And with that in mind, I bring in Dr. Elie Cole. She is a doctor of acupuncture and Oriental medicine, practicing out of the Nourishing Medicine Clinic there in Milwaukee. I knew about acupuncture. I didn't really know it as a way to fight off or to deal with depression. How does that work exactly, doctor?
Well, acupuncture works by increasing the circulation of blood flow to the body anywhere that it needs it. We also know from acupuncture research that it can stimulate the production of serotonin, dopamine, cortisol, all of these chemicals that are feel-good chemicals and gives us energy.
So can you practice some on me right now while I hit you with further questions?
Yes, I can. I can multitask.
Now, I don't want to get too deep because really we don't have the time for that, but honestly, some of the causes of depression, we're blaming the winter blues or all of this dreary weather we've been having on maybe causing people to have some forms of depression, but really it can go deeper than that. I know. What are some of the other causes for depression?
Yeah, absolutely. Well, 90% of our serotonin is actually produced in our gut, which means that diet is a huge thing, right? So the stronger our digestive system can be, the healthier that we eat, means that the birthplace of our serotonin can be very effective and strong.
I knew I wasn't going to take off my jacket or my shirt this morning, so I assume the needles you're about to place in me are going into my face or my skull.
Yes, so some common points for treating depression are on the scalp, the face, and the ears. So I'm going to start with this point right on top here.
That's fine.
Okay, there we go. That's the first one. It's in.
There's a needle in my head.
And now there's going to be a second one.
That one I felt a little bit, but I did not feel the first one at all. I still don't believe there's two in my head.
Okay, now there's going to be a third.
Okay.
I'm going to just pinch your skin here.
Okay.
And boom.
Now, I didn't feel that one either. So 2 out of 3 were absolutely without feel, and the other one I did feel felt like almost like a kiss. It was that serious.
Oh.
But one time, I was telling you that one time, I had about 12 years ago, I did an acupuncture segment, and they put this needle about probably where you put yours and some blood drip down in my nose, and you said that's not going to happen today.
It's not going to happen.
Because you're a professional.
Yes, that's right.
Can you talk about how acupuncture can treat different people in different ways, or I guess how it affects people depends on who you're dealing with?
Yes, so I could have 3 different patients come into my office all complaining of depression. And I would treat them in 3 very different ways because likely they have 3 different causes to their depression. They probably have 3 different ways that their depression manifests. One person might be fatigued and lack of motivation. The other one might be irritable and can't sleep at night. And the third one might have no appetite and is losing weight. Right? Those are 3 very different pictures. So I'm going to treat them in 3 very different ways. So that is the beauty of Chinese medicine, is that we treat each person according to their unique presentation.
Actually, when you put that third needle in my head, it triggered a thought.
Oh,
yes.
You're a thinking man now.
It was very stimulating. No, honestly, I was always led to believe, I was always of the understanding that depression can be inherited. If your mom, your dad, your grandpa, if it's in your family bloodlines, you too can suffer from this. Is that true?
Yes, that's absolutely true. But we have to remember that genes are like light switches. So our lifestyle choices can flip on that switch or flip off that switch. So yes, we often have similar lifestyle as our mother or father or grandparents, right? And so therefore we are likely to get the same genetic diseases that they do. But if we make different choices than our parents, from diet, exercise, stress relieving items, then we can flip off that genetic switch.
I have to ask as we wrap up, how long will these needles remain in my head?
I don't know, is tomorrow okay for you?
Tomorrow's fine.
Okay.
Let's do it tomorrow. She is Dr. Elie Cole. You can find her right there at the Nourishing Medicine Clinic, an acupuncturist and Oriental medicine specialist. The Nourishing Medicine Clinic, of course, again in Milwaukee.